Well, thank you very much, David, for telling your story. Listening to you talk about the prescription drugs that have kept you alive remind me of my granddaughter. I have a granddaughter with type 1 diabetes, and without insulin, she would not be alive. And one of the groundbreaking provisions that we passed in the last session was the cap on $35 insulin for people on Medicare. Unfortunately, we need to make that $35 cap on insulin available to everybody who has insulin. And we need to make sure, let's put this in a bigger frame of healthcare and the importance of addressing the healthcare needs of the American people. Because one of the things that our family finds the most frustrating, and I bet you do too, David, is the fact that every year my granddaughter, who has type 1 diabetes, who if you know anything about type 1 diabetes, you know that it's a chronic illness. It doesn't go away. It's like your blood cancer. It's not going away. And yet, every year, the insurance company tells her she has to prove that she has type 1 diabetes. I mean, it's like, it's hard to explain how frustrating that is, especially from people who are supposed to be there to ensure that the health care of my granddaughter and the people they represent is protected. Sadly, as we're looking at what we need to do to continue to address prescription drugs, what we're seeing is that our Republican colleagues and the Trump administration are starting to discuss tax breaks for the wealthiest people and biggest corporations, but they're not talking about how to continue to keep down the cost of prescription drugs for Americans. I saw an interesting ad this morning where President Trump was taking credit for reducing the cost of prescription drugs, and he just got into office and just signed those executive orders that Senator Klobuchar talked about. What we know is that we need to address the cost of prescription drugs. We have a family in New Hampshire from Hollis who sadly are also dealing with diabetes. Amy and Lily Brady. Amy's mother passed away from diabetes related to complications and mismanagement of her system because she couldn't get affordable insulin. Amy's daughter Lily also has type 1, and they're not sure that they can continue to address the challenges from her disease. Now, thankfully, Amy is able to manage the current cost of her daughter's insulin, thanks in part to steps that we're talking about this morning to lower the cost of prescription drugs. But as we know, not all families are so fortunate. And in the last 4 years, we have made tremendous progress to lower the costs of prescription drugs. And there are real opportunities for us to continue that progress. But we need to work together. It's one of the reasons that I introduced legislation to make permanent the premium tax credits to allow more people to afford the cost of health insurance. But the cost of prescription drugs is a big piece of that. We stand here ready to work with our colleagues in the Senate, in the House, with the Trump administration to keep lowering those costs of prescription drugs. We want them to come to the table to work with us. Thank you, Senator Welch.